My expectation is to continue the healthy dialogue with my colleagues from the PAHO sub-region about the issues that confront all of our societies, all of our citizens on health matters, and at the highest level to come to some common understanding as to how we will move the agenda forward. NCDs, I believe, is the major health challenge confronting all of our economies in the region. All of us have clear evidence as to the prevalence rate of NCDs, diabetes, hypertension, cancer, etc. And we can mostly translate that into costs, real costs, to families, the communities, the economies on the whole. We have done quite a bit of work at the regional level, international level, on this matter, including UN high-level meeting. In Barbados, we have taken on this matter aggressively. We recognize that we are spending about 60% of our national health budget on NCDs. And our healthcare system is one that's primarily state-funded. So we're spending quite a bit of money on NCDs. And as we all know and appreciate, NCDs, generally speaking, are avoidable. In many instances, they're avoidable, related to one's lifestyle. So in Barbados, we have made a shift towards the preventative aspect of healthcare, encouraging Barbadians to lead better lifestyle, exercise, diet, such related issues. We've taken the battle into the primary care level, because what was happening in the past in Barbados, and I'm sure in many other countries, the emphasis was on the curative aspect. So you lead a lifestyle you choose to lead, you get diabetes, persistent hypertension. We spend money on essential medicines, surgeries and such like, which doesn't correct the problem per se, but perhaps extends your life a little bit. We said, look, let us put some resources into avoiding people becoming ill. So we've targeted young people in particular, educating them about the harmful effects of the lifestyle, the harmful effects of the food they consume, encouraging and working with, for example, our Ministry of Education to ensure that there is a regular and a sustained program of exercise to all of our young children in the school system. We've targeted men who have poor health-seeking behavior, period. We say to men, look, you need to come forward and get your regular checkups. We've gone into barbershops, for example, and targeted the men so that they become aware of their challenges and come forward. And we've taken a whole of society approach to addressing NCDs. Here at this PAHO meeting, NCDs will loom large on the agenda, as I said before, because it share impact upon our societies. I'm expecting coming out of this current PAHO meeting that there will be some concrete agreements as to what we can do as a sub-region. Coming out of the UN high-level meeting, coming out of discussions at the World Health Assembly earlier this year, we set some targets. We need now to sit as a sub-region and translate that into doables, the things we need to do to achieve those targets. Start to redefine them and contextualize them within our scenario here in Latin America, North America, and the Caribbean sub-region. In Barbados, we have the advantage of being able to provide good prenatal and antenatal care. At the primary care level, there's immunization. There are programs targeted at young people to avoid them developing illnesses. And they form an integral part of our national health strategy in terms of caring to our young people. I wouldn't say that it's a major challenge. I think there are perhaps other issues that we have to grapple with, without, of course, diluting the importance of integrated child health program. There is the need to raise the bar in terms of use of modern technology, period. Access to modern technology, access to decent bandwidth, access for our young people, and not so young, to this kind of technology. And then, of course, zeroing in on bringing it into the healthcare system, where all evidence is there that using it in the right manner and the right level of consistency can help contain first and then reduce the costs of healthcare particularly in places that may be having some remote access issues. There's also the realization that it helps with resource management in areas where there's a level of deficiency in terms of human resource to address some issues. Telemedicine, using technology in medicine is of tremendous assistance. In Barbados, we have not been afraid of embracing technology within the healthcare system. We haven't gotten it to the point where we want to get it to. Fortunately for us, most of our citizens use modern technology, cell phones, internet, whatever. So we've passed that threshold where it was an issue of access and knowledge. We now need to get to the level of applicability. And we started it quite a bit. Some of our human resource training programs, for example, using modern technology. If you take, for example, the main hospital in Barbados recently started teleradiology. The sheer challenge in having an adequate number of radiologists available, we've opted to outsource some of that. So the imaging is done in-house, and then they're sent via the internet to a remote location where you have the specialist skills who can interpret the images and send the report back electronically within a few minutes. That has helped and will continue to help improve patient care, access to services, etc. So we certainly embrace and recognize the importance of e-medicine today. A well-informed patient is the kind of patient who helps us to contain the cost of healthcare. And we believe in, and certainly as we move ahead with our preventative strategy, we believe in getting the message across to patients and potential patients as to what they need to do and how to do it. It doesn't mean that they're not going to go to the doctors or the nurses anymore, but we want to improve upon communication. What's been happening, I think generally speaking in the past, is that you stay at home, you feel unwell, you go to the doctor, you get medication, etc. Through our health promotion activities, whether it be sending out text messages on NCDs, going into community educational programs, we've been able now to create a much more enlightened population who now is able to better manage their health situation in their own environment. And that has and will continue to lead to a reduction in pressure on the public healthcare system. And so I'm a big fan, a big believer in the importance of health promotion, the importance of effective communication within our societies. It will vary from society to society, but generally speaking, I think that here at PAHO we can have strong agreement that there must be improvement in communication on healthcare matters.